Hi, my name's Ashley Christensen. I was born and raised in the Salt Lake area of Utah, and this is my nursing interview. The main things that grit means to me is being an intentional learner, being determined and consistent, and building relationships. Intentional learning is so important, especially as a nurse and medical professional, since the medical field is always changing, it's always advancing, especially in technology. So I think being intentional on learning that technology on how to best help your patient and maybe even being the one to advance that technology is what makes a great medical professional. So as I become a nurse, I plan to, have continuous learning and advancements. With learning and achieving success in school and in a career is not about being the smartest one in the room. It's about having consistency and having determination, and I think that is a big part of grit. I've always loved school and I love learning, and I think my GPA really shows that. So I think the best thing that you can do when it comes to growing and excelling in school and career is putting the time in and being committed, which I plan to do as a nursing student and a nursing professional. The next thing that grit means to me is being focused on growing relationships. I came to Dixie all by myself. I didn't have any friends or family down here, so it was really important for me to build relationships in order for me to succeed. So I plan to have that same intent as a nurse and, build relationships with patients and their families so that they can have a good experience and be super comfortable. So to me, grit means learning purposely, being determined and consistent, and building relationships. Nursing professionalism is so unique. It's not like your typical business professionalism where you're trying to increase sales or make more money. You're there to save lives and to heal people, which I just think is so powerful and is what motivates me to become a nurse. So nursing professionalism requires empathy, high emotional intelligence, and being able to work in high pressured situations and communicate with others in order to, like I said, heal people and save lives. So I believe that I have a good foundation of these skills because I went through a really hard time when my parents were getting divorced. Through this trial, I learned and gained a lot of empathy, which went right along with building my emotional intelligence. My family situation always felt like a high pressured situation, but through this, I didn't give up. I still went to school and I graduated with a 4.0 GPA in my last semester of high school when the divorce was happening. So I believe that I can exemplify great nursing professionalism. The biggest reason I want to go into nursing is because I want to be able to work hands-on with patients and make their lives better. I'm focused on going into women's health as a nurse, and I want to be able to care for women and touch their lives in a special way. I want to be able to provide care without any bias or harm. I was fortunate to have an informational interview with a PA who works in women's health, and she told me that the thing she loves most about her job is being able to connect with women in such an intimate way and make their lives better through medicine and care. And once she said that, I knew that's exactly what I wanted to do and what I plan to work hard to contribute as being a registered nurse.